Dr. Amol Raut will, being the founder of AIRGenomix Pvt and having positions in gene biotechnologies earlier, and his experience in research as well as in practice, will be rightly apt person to deliver to us the understanding of the principles behind omics, and this is going to be our way forward in the next coming from, let's say, 5 years onwards. All the young people here in practice or going to be in practice now will be using it as a major method of practice. So what we are going to be looking at here is something which is definitely crossed our threshold, some of the things which are on our threshold and some things which are on the horizon, but we are surely reaching there. Dr. Amol Raut, please welcome, and help me welcome sir with a good round of applause. Thank you.
Now we are going to talk on another topic, omics, and that is precision nutrition in omics. Before I begin, first of all, once again, my best wishes to all the nutritionists and dietitians on this very important day, which is the Dietetics Day. So I believe it, for me, it's a pleasure, a non-dietitian, a non-nutritionist, going to talk on precision nutrition and its connection with genomics. I'm honored to be doing that today. And second important thing, I believe this day is also important, since we are going to talk on omics, is because yesterday itself, our Prime Minister, Shri Narendra Modi, he declared completion of India's first comprehensive 10,000 human genome analysis and human genome project. So it's a achievement that India has taken, where so individuals from different ethnicities, groups, geographies, locations were sequenced for their genetic makeup, and that data is going to be useful to us in many ways. And I believe, ma'am, thanks for selecting this topic, because I think it is the right time now that everybody should know about not just genomics but other omics. And that's the reason why the Prime Minister has given a clear message to the entire nation. He thought that it is important, the government thought that it is important to talk about genomics with the entire nation. And that's the reason I think I'm glad that we are going to talk on this subject today as well. So with this preface, I'll be happy to quickly start my discussion today in next 25 minutes. I'd certainly assure you doing that. As I mentioned, I don't come from that nutrition and dietetics background, but I'm glad that in last 14 years, I got an opportunity to work extensively in the field of nutrigenomics, pharmacogenomics, and few other genomics. I'll come to the word genomics. But my encounter with this field of nutrigenomics was developing some nutrigenomic tests, assays, and not just offering to people, but also being a part of certain research activities, whether it was sponsored by Ministry of Ayush or some other government and non-government organizations and so on. Also glad to mention that we could do testing and analysis for close to 30,000 individuals in the country. So there's a lot of information, and interesting piece of information that every dietitian who is practicing today, nutritionist or doctor who is practicing lifestyle disease management, and the aspiring dietitian and nutritionist, they should know about it. So let's talk about first nutrigenomics, and then I'll come to the other part of the topic. Today's topic is precision nutrition and the omics approach. Now, I don't have to specifically tell you what is precision nutrition. We all know that it's personalization and knowing, going to an individual level and finding what is good for an individual in terms of nutrition. Let's start with nutrigenomics. Now, nutrigenomics as a science completely opposite with what we heard in the morning. Dr. Chakma had very nicely explained that how malnutrition and other stresses are important for a certain group of individuals in the country. And here we are talking about another group of individuals who probably are exposed to so much of food that it is creating a stress on their health. And that's the reason why all lifestyle diseases and metabolic health is getting affected. However, in doing that, in managing those conditions, nutrigenomics has played a major role. We all know nutrigenomics, at least most of us have heard about using DNA tests to find out what is the right nutrition or exercise or lifestyle recommendation for an individual. Now, for those who feel that, okay, this science is a bit new, has still not taken up, let me share some interesting numbers. Okay, around 30 million people globally have so far undergone nutrigenomic analysis. That means there are around 30 million reports, analysis, and utilities of this nutrigenomic analysis that people have seen so far. And especially in last 5 years, around 100+ organizations specifically across the globe have started working in this field of nutrigenomics. Now, I always talk about these numbers because there is something very important for India as well. Now, the projections say that in next 5 years, again, around 2 million Indians may be taking up nutrigenomic tests. And who's going to help them decode that nutrigenomic analysis, or where these people are going to come up with their genomic report? They are going to come to you. When I say you, the fraternity of dietetics and nutrition, the experts who are working in the field of lifestyle disease, they are going to come to you saying that, oh, we have done our nutrigenomic analysis and please help us understand how to use it, and so on. So while this sounds very exciting from, maybe some science that we have heard so far, to huge number of people doing and so on, and majorly it will be in the area of diabetes, PCOD, obesity, and so on. So most of the lifestyle diseases which people are currently experiencing, and that's the reason why doctors, dietitians, nutritionists who understand nutrigenomics will be very high now. So for all the students who are now going to enter in the world of dietetic counseling, nutrition counseling, for them, it is important that you look at this science, not just nutrigenomics. I'm going to talk about other as well, but the clients, the patients are going to, in the world, people are going to ask you about what this science is and how to use it. However, if you feel that this is okay, this is very nice, promising, exciting, a new science taking up, now let's start discussing some of the concerns. Okay. Now, what are the concerns? And the host right in the beginning, I believe Huda, she had asked how many of you know about omics, and we hardly saw any hands raised up. Fine, that's perfectly fine, because that's the reason I'm standing here today, to talk about omics. Okay, so omics is a science. Omics, for that matter, is a group of science where studying biological parameters is involved, whether those biological parameters come from genomic data, they come from the gut microbiome data, or they come from the metabolite or the collection of metabolite. All that comes under the category of genomics. Now, so far in earlier slide, I had explained that around 2 million, 5 million individuals in the country will undergo such analysis, or will be taking this analysis. The problem is not that number. The problem is the requirement to tell them what is to be done with that data. This is another slide which talks about chronic diseases in India, metabolic diseases. I don't have to separately explain that how metabolic diseases are on rise in the country, whether it is diabetes, obesity, hypertension, PCOD, so many things. The number is still simply going on. Now, with these numbers, let's try to look at another number of certain diagnostic tests that are done. These numbers that you see on the slide are the numbers of the routine blood tests that are done for diagnosis of lifestyle diseases or management of it. So I'm talking about the lipid analysis, lipid profile, I'm talking about sugar analysis, I'm talking about TNF alpha, IL-6, many other. Now, around, and if you see the numbers, the people who are going to take up, who will be doing such type of analysis, the number is 200 million, 250 million, and so on. So almost 35% population will be doing this type of test. They are already doing it. Now let's compare the numbers, where we have the common or the routine diagnostics being done to almost 35% of the population. The omics test is just 5 million, okay, or 2 million for that matter. So why is this such a gap? Why is it so that the conventional diagnostics is going, of course, it has already taken center stage. It is important clinical management, there's no doubt about it. But when we believe that the field of genomics or any other field which is now taking up is so important, why is it so that only 2 million people in the country will be taking up this analysis? So even globally, only 30 million people have done. So what is the problem? What is the gap? Why this is happening? Is it not important? Are there any gaps in the science and so far? And hence, let's try and understand why omics so far has not taken the center stage, why the spotlight is missing on omics. So why omics field is not come under the practice of each and every doctor and dietitian. So what is stopping? And I believe it is important for us in this audience today to know that what omics is, who should use it, when it is to be used, what are the challenges, what are the benefits, and what are the gaps. So my next 15 minutes I'll be trying to spend on this activity to help you understand what the science is, how it is useful to you, and when all should you use it, and when all, in which cases it should not be used. That's where we come to the first part of next 10 minutes discussion on omics, and that is what is omics. So when any group of biological parameters are studied for a particular aspect, whether it is genomics or whether it is microbiome or understanding different metabolomics, then such science usually is called as omics. Let me take certain names. Genomics is common. So what is the difference between genomics and genetics? Genetics is science of heredity. So when let's say diseases such as sickle cell anemia, thalassemia, okay, or many other inborn genetic errors, the science of understanding how they will pass from one generation to other is the science of genetics. Genomics is looking at the DNA and the information in the DNA of every individual, decoding that information and understanding what is further stored in it apart from the known diagnostic markers, apart from the known disease markers. So that is genomics, which means it involves studying the individual with respect to different information pieces that are present in the gene. The second is proteomics. Genomics in this list is pretty common, and as I mentioned, I also gave example of nutrigenomics. Similarly, there is a science of pharmacogenomics as well. Proteomics is a new science, understanding the different types of proteins that are produced by human beings, using that as a marker to understand the individual better and using that information for treatment. Just to give a simple example, interleukin 6, TNF alpha, we know that these are markers of inflammation. But have you, and we also do the analysis of these proteins through several diagnostic tests. But have you wondered, we will also be able to understand the different proteins, different enzymes that are produced by an individual and at what level. So understanding all those proteins, the different hormones that are produced, when they are produced, when they will not be produced, etc., that science is called as proteomics. Metabolomics. Amino acids, vitamins, fatty acids, we all know these molecules have a strong interplay in the human body. And when certain amino acids will, when they are required or deficiency of these certainly result in some of the diseases or maybe some metabolic health issues and so on. But now a profiling mechanism is available where instead of only relying on some blood test which will map probably only a vitamin B12 or only maybe certain amino acids and so on, you can now have an analysis where all the different important metabolites that are present in an individual can be mapped. And that too, it could be done using a saliva, a blood, a plasma, or a urine sample, or maybe at times a combination of it. So there are technologies, whether it is GC, HPLC, or mass spectrometry now available, which will give a complete list of what is the orchestra of different metabolites that's happening in the human body. Why all this is needed? All this is to be considered as a tool of further understanding how a disease progresses, why a certain individual is a stubborn or a refractory case of a particular disease, or also to understand if a person will in future have any disease based on the trajectory of these metabolites that are present. So for preventive management or also understanding the refractory nature of an individual, metabolomics could be used. Transcriptomics and epigenomics, these two are quite combined. In the morning, we heard Dr. Yajnik talking about epigenetics or epigenetic mechanisms. So let's say, for example, in simple words, translating it in practice component, suppose I am born with a tendency of showing very high inflammatory marker, very high levels of inflammation. My genetic makeup is such that my TNF alpha genes, interleukin 6 genes are overexcited, and given a little bit of stress, my body will suddenly start producing large amount of such molecules. However, if I start seeing in an environment where there are a lot of anti-inflammatory elements which help in subsiding those inflammation, there is a possibility that those environmental markers put a lock on my gene and they actually tone down the levels of which the TNF alpha and interleukin 6 are secreted. Now, this is precisely that also happens in the womb of a mother. When the child is developing, certain genes are masked, I won't say they are switched off, but they are definitely toned down with respect to the hormones that are produced. And that is the reason why Garbha Sanskar is important. So when you talk about Garbha Sanskar, it's the environment in that womb which is influencing the way in which the child is developing or the type of genetic makeup the child is developing. Now, believe me, epigenetics is reversible. That means unlike the conventional genetic makeup that a person is born with a mutated gene, once born, the person cannot change that gene. But epigenetic mechanisms are reversible. So which means that in good situation, in where anti-inflammatory environment is there, inflammation can be reduced, but at the same time, If it is removed, then probably the genes can go back and start working at their original level, creating more of inflammatory situation. So it is a reversible mechanism, and that's the reason epigenetic markers, though they can be transmitted from one generation to other, it's not necessary that they will stay as it is. That's the reason why epigenetics is being studied in context of anti-aging these days. So what is anti-aging? The mechanism of senescence, or the mechanism of increasing death rate of the cells. With the help of epigenetic mechanism, when you try to generally overall reduce the stress in the body, the rate of death of the cells can be reduced, arrested, and that's how aging can be, I won't say stop, of course we cannot stop it, but to a certain degree it can be retarded, at least with respect to certain tissues. So the science of understanding epigenetic is to understand how these markers could be reversed. This is the broad area. So when you talk about epigenomics, these are some of the common areas now that are being studied. Obviously, when you are consulting a person who is suffering from diabetes, a person who is suffering from PCOD or dyslipidemia, etc., what is the time or when is the right time to think about these strategies, right? Obviously, it changes. Every person, every patient, we may not be able to utilize this. And that's the reason, especially for the students, it's my sincere urge, please keep your eyes open to these science. These are the MRIs and the USGs and the other diagnostic features of the past. Now they are going to be taking some or the other position in coming years. And that is why you all need to be aware of what is happening in this field. And probably today's discussion which LSI has organized, I think can be one of the important step in doing that, to keep your eyes open and be vigilant about these different science. In today's discussion, of course, I thought that I'll just discuss 2-3 of them very in brief manner so that we understand how it is actually working. So nutrigenomics, gut microbiome, and epigenomics. Okay. Now nutrigenomics, let's try and understand why nutrigenomics is so important and what actually happens when people study nutrigenomics or when nutrigenomic analysis is done. Fortunately, in the field of genomics, there has been significant research that has been happening, and as I mentioned, yesterday's declaration of completion of human genome analysis for 10,000 individuals was one of it. Likewise, throughout the world, there are thousands of researchers, there are hundreds of organizations who are working in the field of understanding genetic makeup and how it influences a person's life. Okay, so genomics as a whole is definitely going ahead in terms of helping doctor, dietitian understand who the individual sitting in front of you in form of a patient, a client, what he is or she is by nature, and do you need to look at that person's genetic makeup to answer certain questions. What are those questions? Let's take examples. MTHFR, this is a gene, methylene tetrahydrofolate reductase, fine. Now MTHFR gene is involved in providing the ability to convert or to have sufficiency of vitamin B9 in the human body. There are around, my experience of doing probably, MTHFR analysis for a couple of thousands of individuals in the country, it says that around 35% people in our country do not have an optimum mechanism to convert folic acid into a bioavailable version called as methylfolate. Now when that doesn't happen, what happens is concurrently, while the B9 levels reduce, homocysteine molecule also increases in the body, and that homocysteine obviously has its own impact. So if an individual is suffering from neural, ladies having a history of pregnancy losses, neural tube defects, if a man, if we are talking about a male, if he has a family history of early hypertension, etc., all these individuals, if they have MTHFR mutation, they are going to need a very specific type of vitamin, that is methylfolate, as a part of treatment, and not any vitamin B9. So when do you need a MTHFR analysis? When there are certain indications, and these indications, of course, are present. Similarly, there are genes like FTO, APOE. FTO talks about the fat and fat mass obesity gene. It tells whether a person has a tendency to accumulate more of central, obesity. Also, for what is the snacking tendency of an individual, whether he'll be prone to eat large volumes of food, etc., and many multiple things. APOE gene, again an interesting gene. We might have heard about apolipoprotein E lipid analysis. But around 25% people in the world have such a variant of APOE gene that predisposes them to dyslipidemia. These are the individuals who, if they consume fish liver oil supplements, their HDL levels reduces and LDL increases. So if your patient is not responding to the conventional treatment, probably he or she belongs to that 25% category and is not going to respond to the conventional method. And this is how understanding certain genes in an individual can help in solving or addressing questions of the patient that you are trying to treat who has certain issues which are not getting resolved. That's the reason, audience, why nutrigenomics or the science of understanding genetic makeup of an individual is important. Now, how it is done? We all are born with the 30,000 plus genes in our cell. The science relies on looking at the variations in the genes or mutations in the gene, generating a profile of that mutated versus not mutated genes. And then organizations like us who are in the field of generating maybe an analysis report will provide that analysis which can be used by a doctor dietitian to carry out the treatment. Is it only related to fat mass, obesity, gene, dyslipidemia, obesity? No, there are several day-to-day experiences as well. For example, caffeine sensitivity. Caffeine is not just a recreational beverage. Caffeine sensitivity could lead to a sensitivity towards hypertension, early hypertension in individuals who are slow metabolizers of caffeine. So as you can see over here on slide, there are some people who are slow metabolizers of caffeine, especially after high intensity of workout. They start consuming coffee or they consume coffee, multiple doses of coffee. Caffeine can remain in their body for a longer time. The elimination is not very quick, and that's how the levels of caffeine increase, further triggering blood pressure. So understanding the caffeine metabolism, not just that, also understanding alcohol metabolism, why some people suffer from Asian flush, okay, why some people suffer from certain I would say undesirable effect of alcohol consumption. Why? Because the body doesn't eliminate alcohol quickly. So I'm just taking some examples over here, obviously due to restriction of time, but believe me, there are somewhere around 250 plus parameters across the world which different research groups, different scientists have studied, and they think that this information could be useful to a dietitian doctor treat lifestyle diseases, help a patient manage his or her lifestyle disease. So we are talking about fine-tuning of lifestyle disease management. Obviously, it's applicable in all those cases where most of the treatments that you are trying to give are the person is not responding. The person's adherence is always going to be a question, but apart from adherence, if you believe adherence is good, what could be the reason is that person's genetic makeup could be the reason. So this was about genomics, of course, gluten sensitivity, whether a person has a tendency of celiac disease or not, and these are certain examples. Now coming to the next two examples quickly, gut microbiome is again an emerging field. Simply gut microbiome, see, we as humans, we have a lot of microorganisms on our body. Whether it is the oral route, the respiratory route, or maybe the intestine, huge organism load is present, and it is said that we probably carry around 2 kgs of microorganisms in our body. So if we remove the entire microbial load, we will be minus 2 kg. That doesn't obviously become a weight loss strategy, but yes, that's the number of, or that's the load of organisms that we have. Now these microorganisms and their diversity is different for all of us. Okay. Obviously, amongst the group of organisms that are present in our gut, some are established beneficial organisms, lactobacillus, certain strains of lactobacillus, which are good. They help in producing vitamin B12, anti-inflammatory marker. We want them to be there. Some of them are notorious, which are commensals, opportunistic pathogen. They're just staying over there and waiting for the right time so that they could start, troubling your gut. Now, these are opportunistic pathogen. Our dear friend Escherichia coli is also one of it. Okay, it's throughout the lifestyle, E. coli will be there. And then there are many other organisms which are established pathogens, which means their presence in the gut is going to create some or the other issue. So scientists across the world now, they have profiled these bacteria as beneficial, commensals, and pathogenic. And analysis or gut microbiome analysis is now possible to help you understand whether the patient whom you are treating, if he or she is suffering from IBS, okay, or maybe a celiac disease, or maybe acidity, even certain psychological issues, diabetes, obesity, metabolic factors also are influenced by the gut microbiome. So gut analysis or the understanding diversity of microorganisms, understanding what is their profile, and taking a decision on whether if there is a commensal or a bad organism, you don't want it to be over there. Obviously, there are strategies to eliminate that microorganisms, and there are strategies to introduce beneficial organisms. Now, how do you introduce beneficial organisms? By bringing probiotics and prebiotics that will fuel their growth, and how to eliminate the we have 5 minutes? Oh, okay, good, thank you. To eliminate the non-beneficial microorganisms, obviously inclusion or exclusion of certain foods will also be able to do that. So this is gut microbiome analysis. Next is epigenomics, epigenetics. I spoke about the application or the science of epigenetic. The testing of epigenetics is also another genetic testing which could be done probably using a blood sample. However, please let me also give a word of caution over here. Nutrigenomics or pharmacogenomics is a much evolved science. Microbiome also is evolving, but epigenetics still, according to me and several other organizations, is still in research phase. As a diagnostic feature, it is still yet to establish itself. However, my sincere urge to all doctors, dietitians and practitioners is to keep your eye open and read about the research that is available. Obviously, when there are conclusive evidences available, then epigenetic analysis could be used for various reasons, whether it is anti-aging, whether it is lifestyle disease management and so on. And hence, audience, what we are talking about is the age of multi-omics, okay? Apart from conventional disease management, okay, which cannot be replaced. I don't know why conventional is distorted, but okay. So apart from conventional management, which includes clinical management, dietetic management, or use of certain diagnostic feature, nutrigenomics, pharmacogenomics, microbiome, these are other tools that will help you in understanding your patient better and deciding strategies. Okay, Dr. Geeta, after my discussion, she's also, I'm sure, going to put some light on some of them. And the major reasons why this gap today is, or why you don't see all this thing today, is that the key person, that is a doctor or dietitian, needs, who is going to be a decision maker to employ this, needs to be aware of all this. Now, how will a doctor dietitian be aware of it? Unfortunately, there are no government efforts, or there are no efforts from statutory bodies to as of now done, which will enable dissemination of this, but there are many organizations who have started taking their own efforts and initiatives. I believe LSI is also one of it, to at least introduce this concept and connect you with several other people in the world who are working in this field and try and understand with them where nutrigenomics stands, where does gut microbiome stand, what is the status of epigenomics, how it is to be done. So training is important, understanding what are the testing technologies, what are the ethics behind it is also important, and followed by that, even understanding regulations is going to be important. So finally, coming to the, I would say, the summary of this, or the final part of it, the future, of course, is going to be a complex mechanism or views of multiple diagnostic features, whether it is conventional diagnostics or all these multi-omics approach. But a doctor and dietitian will have to be aware, vigilant of all this, interact with different research organizations, please interact with different, maybe commercial organizations who have been working on it, take your own decision, understand whether it is really useful to your patient or not. The simple question that you can ask is it going to help my patient? Is it offering, or any omics approach, is it offering a differential diagnosis? That means something that otherwise you would have not been able to find. Is that tool offering you that? And if it is offering you, yes, then definitely it can become a tool of utility. So that's all from my side so far. Thank you very much for being a wonderful and patient audience. In this time, I thought I'll at least give an introduction to this. I'll be happy to interact later on the different aspects of omics in detail. Thank you so much.